Hello, everybody. Thank you for sitting in. We had almost 60 people register for this webinar. I think a lot of people like to get the recorded version afterwards when they can sort of watch it when it's most convenient for them. This is, I think, a really interesting presentation. Let's see if I can increase my volume a little bit. Sorry. So this is Pioneers of Healthy Lifestyle Longevity webinar series number 4. And our spotlight today is on Dr. Richard Wurtman, who's a medical doctor and a neuroscientist. He's very famous for the work that he's done with the nutrient choline in the prevention of Alzheimer's disease and age-related dementia. I'm a big fan of his work, as I will explain. So let's dig into his history a little bit. He earned his medical degree at Harvard Medical School in 1960, became a member of the National Institutes of Health after a 2-year residency at the Massachusetts General Hospital. He opened a lab at MIT in 1967 to continue his work he started with the NIH in the area of nutrition and food science. So he's a researcher who's looked at the role of nutrients as they affect the brain. So he formed a new department at MIT in the 1980s called Brain and Cognitive Science. In 1994, he was awarded status as distinguished professor at MIT and was professor of neuroscience at MIT and a professor of neuropharmacology at Harvard MIT Division of Health Sciences and Technology. Pretty smart guy. He retired in 2011 after publishing about 1,000 research papers. He trained about 3,000 students and postdocs. Unfortunately, he died last December 13th, 2022. I was really sad to hear that he had died. I first became aware of his work in the early 1980s, and I followed his published work over the years. In the early 1980s, I was doing my master's degree in nutrition at the University of Bridgeport, Connecticut. And I was introduced to his work back then that he was doing with the discovery that choline in the brain becomes a very important molecule to make the memory chemical acetylcholine. So Richard Wurtman really is the most renowned researcher to date regarding the discovery of how specific nutrients modulate brain neurotransmitters in terms of their synthesis, function, and brain health. He discovered the role of melatonin in sleep, as well as breakthrough research showing that certain forms of choline, which I will show you today, can reduce the risk of Alzheimer's disease and dementia and slow the progression of these conditions in the early stages. He collaborated closely with his wife, Judith Wurtman, who's a PhD also at MIT. Judith was most interested in how carbohydrates and serotonin affected the appetite centers in the brain. She published many peer-reviewed papers, some that he co-authored, and several books that she wrote on the subject of controlling food cravings and helping people lose weight through carbohydrate and serotonin management. Shortly after Dr. Wurtman died, some of his colleagues chimed in the MIT news that was circulated. One colleague said his work on the impact of nutrition on neurotransmitters such as acetylcholine and on neuronal membrane synthesis laid the groundwork for later translational work on brain diseases such as Alzheimer's disease. Another professor of neuroscience that he worked with says his nutrient clinical work and establishment of the MIT Clinical Research Center have been tremendously helpful for my own work and understanding how high doses of supplement choline could potentially help reduce certain Alzheimer's risk and our team's development of clinical studies at MIT to test Alzheimer's therapies. So in 2007, because I followed his work quite closely over the years, this book was published called The Handbook of Neurochemistry and Molecular Neurobiology. Chapter 3.2 of the book is co-authored by him. He's actually the main author on it. This is the chapter, I have it right here. You can download, this is really all of his work on choline and brain function put into one beautiful chapter with all the references. You can download that chapter for free at that link, but it's ResearchGate, so you have to sign up and show that you're a practitioner or what your academic stat, answer all these questions. Or you could just contact our customer service rep, Tonda. She has the PDF copy. If you want it, she'll just email it to you. It might be faster to get it that way. So the chapter is called Choline and its Products, Acetylcholine and Phosphatidylcholine. It's a fantastic summary of his life's work over 30 some odd years. Some of the key lessons from Dr. Wurtman, I became aware of his work in the 1980s, as I said, and over the years, these are some of the revelations that he brought forward. As we age, the nutrient choline, no, as we age, less choline crosses from the blood across the blood-brain barrier to get into the brain. This becomes problematic. But when we're younger, the higher your blood level of choline, the more of it can cross into the brain. And when choline gets into the brain, it gets incorporated into the cell membrane phospholipid known as phosphatidylcholine or PC. And then some of that choline gets cleaved off and it's used to make the memory chemical acetylcholine. So because most people ingest suboptimal amounts of choline from day to day, even when they're younger, most of us don't get the maximum amount of choline in our brain to begin with. And so we're never really as smart as we have the potential to be in many cases, because most people don't get the ideal amount of choline, which I will show you. But as we get older, the transporter that brings choline across the blood-brain barrier becomes more sluggish. And so less choline crosses the blood-brain barrier. Even if you ingest a lot of choline, not nearly as much crosses. And it's problematic because choline is required for the brain to make the memory chemical acetylcholine. So brain choline and acetylcholine levels decline as you get older unless you do something about it. The result is age-related memory decline because you have less of the memory chemical. Decreased acetylcholine is a hallmark feature of Alzheimer's disease. But remember, Alzheimer's disease has other hallmark features like beta amyloid plaque and neurofibrillary tangles. So the choline is not the whole story in Alzheimer's disease, but it is a very important factor in Alzheimer's, and it's probably the most important factor in just age-related memory decline. Dr. Wurtman spent many years of his life studying how to increase brain choline levels as people age and to examine if it could increase brain acetylcholine levels and preserve memory and restore early memory loss and aging. And this is what makes his work so fantastic. We wouldn't know any of this if it weren't for Dr. Wurtman. He was able to show that certain forms of choline can raise brain choline levels as we get older. The problem he encountered along the way when I first became aware of his work, he was trying to get choline into the brain in older people, couldn't do it. Because many forms of choline, like choline chloride and choline bitartrate and lecithin and phosphatidylcholine, were not highly effective in preserving the brain choline levels on their own as we age because the blood-brain barrier choline transporter is less effective in aging. Coupled with the fact that the blood-brain barrier undergoes sort of deterioration as we get older, and that deterioration can be amplified by free radical damage or oxidative stress and brain inflammation, which can be linked to different types of events or dietary behaviors, coupled with the fact that there's just age-related changes that occur over and above that. But Wurtman eventually published data showing that supplementation with a form of choline called CDP choline, cytidine diphosphylcholine, also known as citicholine, increases brain synthesis and levels of choline and phosphatidylcholine, which is the most abundant brain phospholipid. So 50% of all the phospholipids in your brain cell membranes is phosphatidylcholine. And from there, the choline can be cleaved off and made into acetylcholine. He showed that even in older patients, he could increase brain choline levels, brain phosphatidylcholine levels, and brain acetylcholine levels, and there are no drugs that can do that. And because it's sort of a naturally occurring substance, most medical doctors are never even made aware of this because, a lot of their training is controlled by the pharmaceutical companies. So all this work he did at Harvard and MIT, most medical doctors never even get a glimpse of it. Studies show that when CDP choline is added to an adequate overall intake of choline, you still need adequate choline intake, and you actually supplement so you get more DHA from fish oil, it greatly enhances brain choline levels, phosphatidylcholine levels, and acetylcholine levels, and improves memory in young people, not just older people, but the students. And in older subjects, it also helps to improve the memory, and it can reverse early stage memory loss. This is very important for an aging population. So CDP choline supplementation has reversed early stage and age-related memory loss, known as mild cognitive impairment. It's been somewhat effective as an adjunct in early stage Alzheimer's disease. Other clinical studies show that CDP choline has been beneficial in stroke recovery, concussion management, brain hypoxic states, and in Parkinson's disease, as you will see. The key takeaway message from my point of view is that you want to, in yourself and in your patients, prevent a decline in brain choline, phosphatidylcholine, and acetylcholine as you age, especially after the age of 50 or 55, because that's when the transport to get choline across the blood-brain barrier really becomes sluggish. Presently, almost 20% of the Canadian population is 50 to 84 years old. Another 2% is over 85 years old. You have a chance to help these people prevent age-related memory loss with the work I'm going to show you today. So supplementation with CDP choline and other synergistic agents. So it works best if there's also lecithin, fish oil, huperzine A, phosphatidylserine, bacopamonaria, high potency multivitamin, creatine. These things all play a role in preserving the memory chemical acetylcholine and enhancing brain function as a strategy to preserve memory as we age. Most medical doctors have never seen any of this research because it's so far, the medical position around aging in the brain is all pharmaceutically based. So CDP choline also increases brain levels of dopamine. So remember, dopamine also declines as you age. But as you raise dopamine, it can be an adjunct to the management of Parkinson's disease and possibly help to prevent it. CDP choline also increases the synthesis of serotonin and norepinephrine, possibly helping to prevent depression and reduce appetite and improve sleep quality. So a great review of everything that CDP choline does is published right there in 2006. I suggest you take a look at that abstract. So let's look at the physiology behind it. I'm making a lot of claims. Let's understand how this works. So here's acetylcholine. If you can see my mouse, this is the memory chemical, acetylcholine. In one step, choline becomes acetylcholine, just with the addition of the acyl group from acetyl coenzyme A. So as long as you have choline in the brain can usually make acetylcholine because this enzyme, the transferase enzyme, is usually undersaturated. It's all dependent on how much choline you have. More choline in the brain, more choline becomes the memory chemical. Notice that serine can become choline. So that's why supplements with phosphatidylserine are also helpful, by the way, because that serine can also become choline and then become acetylcholine. Notice that acetylcholine is naturally broken down in the synaptic cleft by acetylcholine esterase, this enzyme. But you can inhibit that enzyme with a natural agent known as huperzine A and also increase acetylcholine levels that way. So the combination of phosphatidylserine with CDP choline, with huperzine A, can really help to maximize acetylcholine synthesis or levels in the brain. So here's sort of how choline normally gets into the brain. Choline's in the plasma. The more choline you ingest from food, I'll show you the foods that have it, the more choline normally can be carried across into the brain through the blood-brain barrier by the choline transporter. But after age 55, as you're going to see, that carrier becomes very sluggish. Much harder to get choline into the brain after the age of 55. You need to be more targeted, more aggressive in your approach. So to prove that point, in 2019, a great review article showed that the uptake of choline by the brain from the circulation decreases significantly with age. Much harder to get choline into the brain after age 55. And this has consequences. You end up using up the phosphatidylcholine that you have, and then as it runs out, then you start having age-related memory loss, and you also have less phosphatidylcholine, which is a very important phospholipid because it does all kinds of other things. It's a signaling agent. It determines how the cell membrane is going to work. So you're losing both choline and phosphatidylcholine as you age, unless you can replenish it. The reduction of choline with aging has been linked to degeneration of the membrane phospholipids and neurodegenerative conditions, loss of memory, neurons. Thus, choline supplementation with other methyl donors, because you can also make choline in the brain with the help of folic acid and vitamin B12. because they increase phosphatidylethylalamine. We'll see this in a moment. So it helps elderly patients maintain their choline levels. If there's CDP choline, phosphatidylserine, huperzine, and folic acid and B12 from a high potency multivitamin. That's really what this is saying. So in this great chapter by Dr. Wurtman, in that summary of his work, he shows this diagram, which is very helpful. So what he's saying is that when you ingest the supplement CDP choline, what happens is that it doesn't get absorbed intact and just go right to the brain and become CDP choline. There's a series of steps. A lot of so it's CDP choline is cytidine diphosphocholone. So the cytidine gets separated from the choline in the gut. And a lot of the cytidine gets converted in the gut and or in the liver to uridine. Then uridine crosses the blood-brain barrier and becomes uridine triphosphate, and then quickly becomes cytidine triphosphate. Once you have cytidine triphosphate, any available choline you have in the brain will quickly form phosphocholine, but you need the CDP, the cytidine triphosphate, to make CDP choline. Once you have CDP choline, it's a one simple step to get phosphatidylcholine. Now you have the phospholipid that you need, and now you have the choline accessible to make the memory chemical. So in 2007, when this research was published, the thinking was that all of the CDP choline that you ingest gets converted into uridine. But then we found out subsequently that that's not exactly true. Some of the cytidine itself crosses the blood-brain barrier and can quickly become cytidine triphosphate and quickly also make CDP choline. And you'll see why that's important. So what are we talking about? If you think about the cell membrane of a nerve cell or any cell, it's a biphospholipid layer, right? So there's two phospholipids attached to each other. What do phospholipids look like again? Because you probably forgot. It's a glycerol backbone and has two fatty acid chains in a polar group. And if choline is available, then if that polar group becomes choline, you have phosphatidylcholine. Now, here's the R1 chain and here's the R2 chain. If the R2 chain is DHA from fish oil, in the presence of CDP choline, the speed at which you make phosphatidylcholine is even faster if you happen to have DHA present. So that in 2007, Wurtman emphasized that in his review article, that having both CDP choline and DHA from fish oil greatly enhance phosphatidylcholine synthesis and thus more acetylcholine. So the way that it looks is this way. Once you have choline in the brain, the choline then can become choline phosphate very simply. In the presence of cytidine triphosphate, as I showed you earlier, it becomes CDP choline. And then in one simple step, you have phosphatidylcholine. The brain can also make phosphatidylethanoalamine, and it can also from there make phosphatidylcholine, provided you have SAMe, S-adenosylmethionine. You need folic acid and B12 for this pathway. That's really all you have to remember. So the idea is to keep making optimal amounts of phosphatidylcholine over your entire life. Just eating sufficient choline foods after age 55 is not good enough. You need CDP choline and you need DHA from fish oil. So we know that cytidine diphosphocholone is a naturally occurring agent that's shown to increase brain levels of CDP choline and acetylcholine. Choline in the brain is required by brain cells to make neurotransmitters, as we talked about, to make cell membrane phospholipids, phosphatidylcholine and phosphatidylethanoalamine. And also it's a cell membrane signaling agent, so it helps the neurons speak to each other. And CDP choline can provide the brain with the choline to form these things and improve the memory chemical acetylcholine concentrations. There's a great 2006 review that said that actually, when you take CDP choline, some of it crosses the blood-brain barrier extremely well as just cytidine. It doesn't all have to become uridine. Um, so this may explain what happened when Dr. Wurtman got involved with a company, a Dutch company called Numico Research. So they contracted him to make a drink, like a yogurt drink, where he would put these brain nutrients all into one formulation, and then they did clinical trials with it, and they sold it as a product. They then eventually sold to Danone in 2007, and they sold the product as Nutricia. But it really had mixed results, because what he put into the drink was DHA and EPA and phospholipids and choline. Instead of using CDP choline, he used uridine monophosphate, right? Because he knew that uridine crosses the blood-brain barrier, and it could become CTP choline, along with vitamin E, selenium, B12, B6, folic acid. So it looks like a great idea. But the drink didn't contain CDP choline, because CDP choline was developed by Ferrera Pharma in Spain. And I think this company wanted to have a product that they could put a patent on. And because CDP choline already has a patent, because it's owned by another third party, they couldn't really use CDP choline for the product they were making. So in 2013, it was marketed in Brazil and Netherlands, Belgium, Germany, Italy, and the UK and Australia. And the UK pharmacists had to take special training before they could recommend it. In January 2014, the French regulatory authorities rejected the manufacturer's proposed marketing claims on the basis that the target population and its nutritional needs were not well defined, and statistically weak data and the evidence by the evidence provided. They're saying this product is pretty good, but it's not really fantastic at reversing memory loss. And the reason that it wasn't is because they didn't use CDP choline in the formulation. CDP choline is critical to use because the cytidine itself, some of it can cross the blood-brain barrier. If you're just relying on uridine alone, you're probably not going to get the same result. The documented applications that are proven with the use of CDP choline is that it's helpful to reverse early stage Alzheimer's. It helps to slow Parkinson's disease. It's been able to reverse age-related dementias if it's in the early stages. And even people with head traumas get out of the hospital earlier if they use CDP choline, because it has all these beneficial effects that you can see here. So in clinical practice, this is the quote from the research paper in 2015 in the journal Clinical Interventions in Aging. In clinical practice, a number of different studies have clearly shown that CDP choline is effective in cognitive impairment of diverse etiology, cerebral vascular disease, head trauma, glaucoma, amblyopia, and also Parkinson's disease. And most recently, in 2021, in the Journal of Nutrition, they published this fantastic study. They took 100 healthy men and women who had age-associated memory loss. So they already had early-stage memory loss. They're 50 to 85 years old. They do a random double-blind placebo-controlled study. They give half the group 500 milligrams of CDP choline every day. The other half gets a placebo, and then they see what happens after 12 weeks. Well, the results show that after 12 weeks, compared to the placebo group, the subjects ingesting the CDP choline supplement showed significantly greater improvement in episodic memory and composite memory. So episodic memory is remembering things from the past and giving them context. Oh yeah, we were in Italy last year. We were in a boat, and then we went for dinner. I had fish and potatoes. It was really great. We stayed at this hotel. Great memory. Composite memory is this. I say to you, let's take the number 100, and I want you to start counting backwards from 100 by 7. So you go 103, 96, 86. And so you start, and so this is, can your brain do calculations on the spot? Or I say, I want you to remember 5 words. The words are cat, dog, mouse, cheese, and garbage can. And then 10 minutes later, I'm going to ask you those 5 words again. So 10 minutes later, I ask you, and you say, door, window, lamp, desk, and telephone. You go, okay, no, you're not remembering very well. So that's composite memory. The researchers concluded that dietary supplementation of CDP choline for 12 weeks improved overall memory performance, especially episodic memory in healthy older males and females with age-associated memory loss. The findings suggest that regular consumption of CDP choline may be safe and potentially beneficial against memory loss due to aging, and I concur with that. I've seen it help a lot of people. CDB choline is one of the few medicinal agents that has been shown to increase brain choline and acetylcholine levels and improve memory function in older as well as younger individuals. Even younger people benefit, as shown in the journal Basic Clinical Neuroscience. Here are some great references on CDB choline, the clinical studies that have been done. They're all fantastic studies. But CDB choline by itself is not enough. You need to have an adequate amount of choline in general every day from food and or supplements. So the adequate intake of choline is 550 milligrams for men each day and 425 milligrams for women each day. For pregnant women, they need more, and lactating women, they need more, because the fetal brain and the early developing brain requires choline for many reasons for proper brain development, as you'll see. So European surveys found that the average choline intake is very low for women age 18 to 65. The National Health and Nutrition Examination in the United States showed the same thing, that women who have childbearing age especially are not getting the choline they need. Even in Canada, women who are pregnant and lactating, not getting the choline that's required for brain development in their child, let alone their own brain. 90% of Americans have choline intakes below the basic adequate requirement. So, and as we shift to a more plant-based diet and more vegetarians show up on the scene, because there's very little choline in most plant foods, the intake of choline is actually going down across the population. Then studies show that actually the adequate intake is probably too low. For a developing infant, it would be better if the mother actually got 930 milligrams a day, which is double the present adequate intake level that's been set. So the fetal brain and the infant brain really needs choline very desperately. Studies show that, animal studies show it can help protect against brain damage and cognitive neurological declines associated with epilepsy and Down syndrome and Rett syndrome. 22 human clinical studies show it can help to prevent damage done to the brain when the mother's drinking alcohol. The foundations of neurodevelopment are critically important in the first 1,000 days of life. The first couple of years of life are really critical, and the researchers say choline is one of the most important fundamental nutrients for brain development. In fact, the American Medical Association in 2017 said, we think there should be 450 milligrams of choline in all the prenatal vitamins. But most prenatal vitamins don't even have that 450 milligrams. They said if you just did that, we would decrease spinal like spina bifida type conditions by another 50%. There's already folic acid in there to help decrease neural tube defects. But if you added the choline, we would reduce it by another 50%. But no one's reacted to this yet. So the effects of choline containing phospholipids. So the thing is, just as studies show that even for the rest of us, forget about fetal development, total choline intake and phosphatidylcholine intake determine to a large degree our cognitive function. And that's really what this slide is showing. I'm going to pick up the speed because I want to get through this in a timely fashion. Here's where you find choline in food. So a lot of the choline that you found in food, choline is found in a lot of foods that have a lot of saturated fat and cholesterol, which raise cholesterol levels and lead to cardiovascular disease. That's one of the reasons why I like people to take soy lecithin as a supplement each day, because it contains a lot of choline if you're not eating choline-like food. So in other words, beef liver has a lot of choline, but I don't suggest you eat it. Egg yolks have a lot of choline, but I don't have egg yolks because I don't want all the cholesterol. Cod is a good source. I don't eat beef, but beef has some choline in it. So the other sources are, cauliflower, wheat germ, cod, and other types of fish, which are great sources. So you could take 15 grams of soy lecithin a day, but honestly, it tastes horrible. Those lecithin granules, they just taste horrible. Nuts have some choline. Tofu has choline. That's good to know. Certain fish like salmon, haddock, and most whitefish also have a respectable amount of choline. But I think most people would benefit from doing what I do. I buy the Jameson lecithin capsules. They're 1,200 milligrams each. I take 2 a day. That gives you around 300 milligrams of choline as a nice head start every day. And then the rest you can usually get from food. The thing is that to maintain optimal amounts of phosphatidylcholine and acetylcholine, your lifelong strategy is to get enough choline each day from food and or supplements. You want to try to get that 450 to 500 milligrams of choline a day. Taking lecithin capsules can give you a nice big head start. After age 55, I suggest strongly that you take a supplement each day that has CDP choline with huperzine A, phosphatidylserine, and Bacopa monnieri because of all the things that they do. And these are some great references on each of those nutrients. So, I created this formula for Adiva called Adiva Memory Support Complex. It has those 4 nutrients in it. And I would suggest you also take lecithin and take the Adiva Nature's Essential Oils to get the fish oil. From 55 to 60, I would give my patients 1 capsule a day. From 60 to 70, I would give them 2. After age 70, I'd say take 3 capsules a day. The reverse early stage memory loss, what I've seen work is 3 capsules twice daily in conjunction with the other things that we talked about here. Now, Health Canada forces us to put on the label you need to take 3 capsules 3 times a day. But that's how much you would need for a person that has Alzheimer's disease. So it looks like you have to take 9 capsules a day, but you don't. For prevention, you can take much lower doses, just so you know that. I would take that product in conjunction with the Adiva multivitamin because it has the other nutrients that support brain health, folic acid, B12, B6, niacin, antioxidants, vitamin D, bioflavonoids. You've seen the formula before. And I would also use Nature's Essential Oils lifelong because it has the borage seed, flaxseed, and a high yield fish oil to give you the DHA that the brain needs. And I would consider sleepy naturals after the age of 40 as well, because melatonin's also been shown to support brain health, help reduce risk of age-related memory decline, and has reversed mild cognitive impairment in clinical studies. And it has other ingredients to help you fall asleep more effectively, raise serotonin levels, and you see the dosing there on the screen. So this is my brain-preserving recommendation. Of all the things that sort of dovetail together, I would take that Adiva Lifelong multivitamin and the essential oils, maintain a vitamin D level above 75 nanomoles per liter, take a memory support complex after the age of 55, don't eat foods that are going to raise your cholesterol level. High LDL is now considered an independent risk factor for Alzheimer's disease. Keep your fasting blood sugar below 5 millimoles per liter, take a lecithin capsule or 2 a day as I do. And avoid things that are going to damage your brain, alcohol and other recreational drugs, smoking. Endurance exercise is extremely helpful. Get enough sleep, avoid head injuries, use melatonin as you get older, keep your blood pressure down. Green tea's been shown to be helpful in terms of memory support, and creatine supplementation as well. I've talked about this. So I have a complete webinar just on all of these things. If you click on that link, you can see the whole 1-hour webinar on the aging brain and how to support your brain health as you age. So I just want to say a great big thank you to Dr. Richard Wurtman. He really brought a lot of insight. I was very happy to be introduced to his work back in the 1980s, followed the work he did closely over the years. I learned a great deal from him. I suggest strongly that you read that chapter from his book if you're interested in brain health. It's a fantastic review of all of the research that's gone on up to 2007. I've included in the notes things we're not going to cover today, but how the blood-brain barrier ages as you get older. As chiropractors, you might be interested to understand how the blood-brain barrier changes as you get older and why it's so important to really take care of your brain health with the things I'm talking about to try to maximize brain function. So on that note, I want to thank you for attending today. I hope this was helpful. It's been a pleasure chatting with you. See if there's any questions in the chat box. So far, I don't see any. Next steps in the meantime, if you're not an Adiva customer and you'd like to learn about the program and all the support we are able to give you, then please contact Arlene Walker at that address. You can learn more at adivainfo.com. If you want to become a registered orthomolecular health practitioner, there's contact information there. And we had this great customer service rep, Tonda McGillis. She can answer a lot of questions as well. If you want to get that chapter that I showed you emailed to you, then just give Tonda a call. She'll be happy to send you that chapter. So I don't want to hold you longer than what I said I would. So I don't see any questions right now. I'll just wait a minute longer. That's the other way you can contact Tonda is via email. Anyway, Richard Wurtman was really something. I mean, Harvard, MIT grad, doing all that work over the years. And most medical doctors have never seen the breakthrough stuff that he brought forward, because we have this aging population where a significant number of people in this country are now over the age of 50 and would tremendously benefit from these types of interventions. I think really chiropractors can step up and be a big part of the solution to preventing age-related memory loss. The reason why it's so important, in my view, is that cardiovascular disease used to kill a lot of people, and now there are all these medical heroic interventions to save people. Cancer treatments have improved. There's no question about that. Even though cancer death rates haven't changed that much, but people are now living much longer, even if they're cancer survivors or they've had cardiovascular disease and it's been treated, they're on diabetic drugs, so they're living longer. So people are now ending up with dementias and Alzheimer's disease as a result of living into these latter years. That's the thing they have no treatment for. So you can play a huge role in preventing age-related dementia and cognitive decline in Alzheimer's disease by introducing your patients to these strategies. So on that note, I will thank you again for attending today. Next month, I'm going to introduce you to the work of Dr. Russell Reiter from the University of San Antonio, Texas. He is the world's leading expert on melatonin. This is work that you should really take a look at. The guy's published so many papers on it, it's unbelievable. So thanks for attending. I appreciate you being here, and I hope to see you next month. Thanks again.